Good evening, everyone. I'm Mary Ellen Klein, the President and Chief Executive Officer for Clara Maass Medical Center. I do want to take this opportunity to thank all of you who are participating in our virtual meeting this evening. We wanted to be able to share with you a little bit about what's happening at Clara Maass, and also to help you navigate any of your health issues that you may be having that you possibly have put off due to the coronavirus. We do know that a lot of people were very concerned about coming back to the hospitals, and we do want to reassure you that we have taken every precaution possible to ensure the most safest environments for those who need us in our communities that we serve. We have a great team of people and a lineup of our ED staff and leadership who will be able to talk to you about what is happening in the emergency department. And I do want to recognize some of the people who are on the line with us. We do have Stacy Newton, who I'd like to thank for being with us tonight. Stacy is our strategic communications director, and she was able to put this event together for us. So I want to thank Stacy for bringing us together virtually. I have Dr. Frank Mazzarella, who's our Chief Continuum of Care Officer, who's with us tonight, if he can give you a wave. I also have Terry Dielmo. Terry is our Chief Nursing Officer and Vice President of Patient Care Services. If Terry can give a wave to the audience to recognize you. We also have Dr. John Fontenetta. Dr. Fontenetta is triple boarded, one of the boards in emergency medicine. And Dr. Fontenetta really is a true physician leader and helped us all immensely during the pandemic at the hospital. He is an outstanding physician who I get my care from, and I live out in Hunterdon County, and I drive out from Hunterdon with my family for any of our healthcare needs. Many of my family members came out during COVID as well, but I always know that I can trust my health and my life to Dr. Fontenetta, his team, and all the team members that are in the emergency department and with the leadership that are here tonight to share with you. I also have Donna DeVita. She's our director for emergency services. Donna, if you can give a wave as well. We have with us also Bianca Mitchell. Bianca is our assistant director of nursing for the emergency department. And if Bianca can give a wave. We also have Eduardo Padilla, who's with us as well as our assistant director for the emergency department on the night shift. And Stacy, I'm just trying to make this a little bit bigger. I don't think I could see it all. And I'm just going to flip to the camera if I can to see if I'm missing anyone else on the call to be recognized. I see members of our community, Dr. Fontenetta, and I know that there's one of our captains from our rescue squad, Tony Mondero, who's with us as well. Tony, thank you for being with us. But I do want to thank everybody who is on the call tonight. And things at Clara Maass truly are going very well and back to normal. We are preparing for flu season. Our employees have already started to get their flu vaccines. We do want to encourage the community to get a flu vaccine. There's been some new talk in the literature about the twindemics, meaning two types of issues that could happen at the same time, one being the flu and the other, which we hope will be able to avoid the second wave of the COVID-19. So we are preparing and keeping people healthy and well. We want to make sure that your children, grandchildren, anybody you're a guardian over that is a child, adolescent, that they get their regular vaccines as well to keep them healthy. And we want to encourage you to keep your health up as best as you possibly can, because we want to keep you healthy versus having to come to the hospital. But should you need our services, please know that we are always here. It is safe. We want you to come. And please, please, I urge you, do not delay your care. There's medical emergencies that happen to all of us every day. And the worst thing you could do is avoid it by being afraid. We want to eradicate your fears and let you know that it's absolutely safe to be at the hospital. I go to the hospital every day. We go out to the different departments, to the units, and I am fine. And I want to give you that vote of confidence. And for those people who may have a COVID type of infection or COVID positive, we have patients that are sequestered in a different area of the hospital with specific staff to care for them. So we are doing everything we can to keep you safe. So with that, I would like to turn the program over to Terry Dielmo, who is our Chief Nursing Officer and our Vice President for Patient Care Services. Terry?
Thank you, Mary Ellen. Good evening, everyone. Thank you so much for taking the time and joining us here at Clara Maass Medical Center so that we can share with you what we're doing so that we're ready for you whenever an emergency arises. We know that when something happens, we're expecting it, a sudden illness, a certain pain, it can become very, very scary. And you need to know that you want to go to someplace that you can trust and that you feel safe. And that's what we are at Clara Maass Medical Center. We take pride in the compassion, empathy that our healthcare professionals will share with you and any of your loved ones. Because of that, we take special precautions, and especially during these times, we're extremely careful. So when you come in, you will be greeted by one of our staff members that is going to have a mask on and is going to explain to you exactly what is going to happen. Temperature screening is important. We want to make sure that we're going to provide you with the care that you need, and we want to make sure that if you have a temperature or you don't have a temperature, we're going to be placing you in the appropriate place. Social distancing. So we will keep our patients certain feet apart so that this way we will follow the same social distancing that the CDC is requiring from us even when we're not in the hospital. So we're going to continue these practices so that this way, and we will explain it to you as we're going along, so that when you may have a question, please feel free, ask us. That's what we're here for. When you're in a room, know that you've gone into a clean room, because what we do is we clean any space that any patient or any person is in after they have left. So that this way, when you come in, know that our professional environmental ambassadors have made sure that they've cleaned with the best cleaning agent so that we are clean of any bacteria or any virus that could potentially exist. We round and we check on you on a very frequent basis so that you know we'll keep you up to date with what is happening during your stay with us. And your stay is going to be one that we recognize that we want to get you back home as soon as we possibly can. So we are going to take care of you, explain to you what tests are going to be taking place. And the rest of the team is going to go into some further detail so that you know exactly what is going to happen and what they live every day and how they treat our patients in our community all the time. You're going to see us washing our hands when we walk into the room and we walk out of the room, again, we do that to keep you safe. And we do that so that we're not taking one germ from one place to another and we're getting rid of it in between. So when you're seeing us walk in and we're doing this again as part of our commitment to you, that we are here for you. We, as Mary Ellen Klein, our CEO and president of the hospital, has explained, our staff is already starting to take their flu vaccines so that we can protect you and protect ourselves. And so with that, I would love to share with you that the next doctor, the doctor that's going to speak to you now is Dr. Fontenetta, multi-board certified, someone who I trust with my life, and he has taken care of me himself. And he is compassionate. He is committed to his patients. He is someone that will share with you very interesting parts of his experiences that he's learned throughout his career. I'd like to turn it over to Dr. Fontanetta, our chairman for Department of Medicine at Clara Maass Medical Center. Fontanetta.
Well, thank you, Terry, and thank you, Mary Ellen. Clara Maass Emergency Department is a full-service emergency department. We're a stroke center, we're a cardiac center, we have full pediatric and obstetrics and gynecologic services, and we're staffed by board-certified emergency physicians and emergency-certified nurses. As a matter of fact, most of our physicians are multi-boarded, so it means that not only are you going to be seeing a physician that has emergency medicine board certification, but most often they'll also have internal medicine board certification. And the reason for that is that taking care of patients in the emergency department is the most complex and difficult place in the hospital. And the reason for that is that we have to be ready to take care of whatever comes through the door. We have to take care of patients that have surgical emergencies, that have obstetrics emergencies, as well as medical emergencies. We're taking care of heart attacks and strokes. So we really need the best and the brightest physicians in our ED to care for our patients. And we put together that team. As a matter of fact, many of our physicians have been there more than 20 years, which is a great tribute to Clara Maass and its ability to serve its community by having these very seasoned, very experienced physicians that have committed themselves to Clara Maass and to our community. Our nurses are wonderful, many of them certified emergency nurses. We have a very family orientation in our ED. Most of our staff are from the community. Many of our staff are families that work here at Clara Maass, and we'll have nurses whose family members also work in our environmental services or in our food services and such. And that makes Clara Maass a very special place because it's more than just some place where we take care of anonymous patients that come through the door. It's a place where we take care of our own family. And it's a place where we take care of our community, which we treat as our family. So I'm very proud of Clara Maass, and I'm very proud of what we put together. During COVID was a very challenging time. Clara Maass was one of the hospitals that was hit very hard. We had many COVID patients in-house, and we did an incredible job with these patients. As a matter of fact, we learned an awful lot, and our multi-specialists that we have upstairs, our infectious disease specialists and our pulmonary specialists and our intensive care specialists, together with our emergency specialists, really learned how to take care of patients with COVID. And what that means is that patients that if we do have a second wave, we're ready for it. We're ready for it. We have those special medications that have been proven to be effective, remdesivir. We were one of the first hospitals in New Jersey to use convalescent plasma for patients with COVID. So we did a really wonderful job taking care of these patients through a very challenging time. What that also means is that we've gotten very good at keeping everybody safe. And what I mean by that is we were the first hospital in the system to put our tents up outside. And I know for people looking on from the community, that might have seemed like a frightening thing that we had tents up outside, but it was really an attempt to keep our patients safe, because by using tents outside with very good ventilation, we were ahead of the game in understanding that patients needed to be in a place where they weren't in a room, where there's good ventilation, where they can be brought in safely and seen safely and evaluated and sent directly home from the tent. So we saw hundreds of patients a day at the beginning of the COVID crisis through the tents. Everyone kept very safe. Everyone given very good instructions and able to go home and be able to keep their families safe. For patients that were sicker, we created separate areas within the ED. And luckily, those of you who have seen Clara Maass's emergency department, we have a very modern, very large emergency department with multiple sections. We have the largest observation unit in the state of New Jersey. We have many different areas, pediatric observation. We have a fast track area. We have our main ED. And having those multiple areas allowed us to segregate patients very effectively and very carefully. So patients that came in that were suspected COVID were kept in separate areas where we had all the right equipment to be able to care for the patients and keep everybody safe. So if you were to come into the emergency department now, you would note that as soon as you hit the door, you're evaluated for the possibility of COVID. If we suspect that you are a potential COVID patient, we'll put you in a separate area. We'll put you in a room where you're going to be isolated from the rest of the emergency department and kept safe. The room would have been thoroughly cleaned. We have some very technical equipment now that we use to clean rooms. We have ultraviolet lighting that sterilizes rooms. We have machines that will aerosolize antiseptic solutions that will be able to get into all crevices within the room to sterilize completely the room that you're going to be going into. So you can feel safe and secure that you're going to go into a room that is not going to give you a disease or an infection. When we see you, we'll evaluate you for COVID. And if you're sick enough that you need to come in the hospital, we have separate areas upstairs for our suspected COVID patients, again, where they're placed in a room where they're isolated, kept safe and separate from anybody else. The patients are all wearing masks in our ED and in our hospital, and all our staff is wearing masks because, again, we learned what we need to do to keep our patients safe, and we've been doing that very well. We see, hundreds of patients, a couple of hundred patients a day in our emergency department, and we see them effectively, and we see all sorts of diseases. Patients, obviously, even though there's a pandemic, patients are still getting sick with all of the diseases that they've had before, and it's very important that we want our community to know that they can come to the emergency department if they need to come to the emergency department. One of the unfortunate outcomes of this pandemic is that we have seen patients that should have come to the emergency department, didn't because they were afraid of the pandemic and afraid of COVID, and did not get the care that they needed. We had patients who needed their follow-up care for their chronic diseases, their diabetes and their cardiac diseases that that did not come in when they should have, and that was an unfortunate outcome. Luckily, now we're beginning to see patients feeling more comfortable and beginning to come back to the doctors that need to see them and the care they need. So we want to make sure the community knows that if you need to come to the emergency department, if you need to come and see your doctor, we are safe and we will keep you safe, and we will do the same wonderful job we've always done in taking care of our community and taking care of our patients. So they asked me to speak a little bit about when you should come to the emergency department and what signs or symptoms should alert you that you need to come to the emergency department. It's a little hard to obviously do a generalization about what symptoms a patient would make a patient have to come to the emergency department, but the best way to determine that is really knowing yourself, right? And most patients who have something significant going on in their health, they'll be aware that something's serious. And patients say, well, how do you know chest pain is serious and as a heart attack? How can you tell the difference? Well, most of the time it's a type of pain that you haven't had before. And that's something that should alert you. The other thing is it's often a pain that you can sense is something serious, and you can sense that pain is not something that you should ignore. It usually causes anxiety. It usually causes other systemic symptoms. The pain, it's different from the kind of pain you would get if you just pull a muscle and such. But that being said, we're there to really to evaluate patients. So we are actually very happy when a patient comes to the emergency department for chest pain, and we'll see them and we do their cardiogram, and we may do an echocardiogram, sometimes a stress test, and we do all of those things and the tests all come back negative, we're actually just as happy as the patient is to be able to say, you're fine. This wasn't your heart. It was something else. Go home, be happy, follow up with your doctor, and we're very happy you came in. So patients shouldn't be concerned that if they're coming into the emergency department that they might not be seriously ill. We want you to not be seriously ill. Our observation unit, which I mentioned earlier, largest in the state. We were one of the first hospitals in the state to have an observation unit. And what the observation unit does for us is it gives us the ability to evaluate patients in a very effective and quick way for diseases that would have otherwise had to be admitted to the hospital. So, for example, if a patient passes out and goes unconscious, they're brought to the emergency department, and there are certain things you need to do for a patient who passes out. And one of those things is obviously you want to scan their head, you want to evaluate the heart for arrhythmias. And in the olden days, we used to admit those patients to the hospital, and it would take 3, 4, 5 days to do all the tests necessary to be able to be comfortable that that patient is safe to go home or to identify the cause of their passing out. With our observation unit, what we've done is we've made the observation unit the priority for quick and effective testing. So if you come to my observation unit, within 18 to 24 hours, I can do all of the tests that otherwise would have taken 3 to 5 days upstairs. I can do a cardiac echo. I can do carotid Dopplers. I can do MRIs of your head and of your brain. We can have cardiologists see you right there. We can have neurologists see you right there. And we can do all that very effectively and very quickly so that you can, within 24 hours, know that you're safe, you can go home, everything's okay. Or potentially, oh no, you do have a problem. You have a narrowing of your carotid artery. We need to fix that. But all of that is done very quickly in our observation unit, very effectively. So the scope of what we do has just become enormous over the last 20 years that I've been here. And we just need the community to know that Clara Maass is the place they need to be if they have any questions of their health, if they're at all concerned and such. And remember, we have wonderful EMS communities in our towns, right? That they are just the most fabulous EMS people that I've ever worked with. And they work closely with our hospital. We sponsor every month. We sponsor educational series that we do with them. We have speakers. We meet with them. We get, sometimes 70, 80, 100 of our local EMS people, first responders, to come to these meetings where we help educate them. They help educate us so that we know that they're safe to be able to go in the community and keep our community safe. And especially during COVID, they just did such a wonderful, wonderful job. Again, risking their own health to go out in the community and keep our community safe. So you live in a very special place. Our communities are wonderful places to live, and the healthcare that we provide is just really top notch. And you're not going to find better healthcare anywhere in the state. So did we want to open it up for questions, Stacy?
Yes. Let me just check our
Stacy.
chat, see if we have any questions.
I hear somebody's typing.
Are there any questions from the community?
Let me talk then while we're waiting for questions about some of the other diseases and things that you people should be aware of. So I mentioned chest pain. Chest pain is very important because if a patient has chest pain, it could be a sign that they have a cardiac problem. And the most common cardiac problem we have is narrowing of coronary arteries that cause the heart to not get enough blood flow. So if that's the case and you're having chest pain, it's very important to come into the emergency department to be evaluated, because we will take you again and we'll place you in our observation unit, and we will have a cardiologist see you. We will stress test you. We'll do an echocardiogram of your heart. And if we have signs that you possibly have a narrowing of your coronary artery, we will be able to take you right to our cath lab. We have a wonderful cath lab with wonderful cardiologists. And we will see if your heart does have an issue. And if it does have an issue, we will put a stent in it and we open up that artery. And the reason that's important is because if you don't come in, you have the potential of that artery closing off and doing damage to your heart. If you come in at the point where you're having pain and you haven't yet infarcted or closed off that artery, we have the opportunity to fix that artery before it causes any damage to your heart, and you walk out of the hospital in better shape than you were before you came in. So our cardiac program is wonderful. Our door to balloon times, the amount of time it takes us to get a patient who's having a critical cardiac issue into the cath lab to be treated, are excellent, some of the best in the state. And you can know that if you have a problem with your heart, Clara Maass is a perfect place for you to be. If you have problems with, for example, let's say an infection of some sort, you're at home, you're running a fever. If your child is running a fever, children run fevers all the time. So the best thing to do if your child is running a fever is to pick up the phone, call your pediatrician. Pediatrician will talk to you over the phone. They may say, come on in, and they'll be able to help you evaluate, if your child, what kind of care your child needs. If your child, on the other hand, has a fever, but is also acting unusual or strange, meaning excessively lethargic, or potentially has a seizure due to their fever, or you have any concerns, and parents are good at this. You can look at your child and you can know if something's going on, that this isn't usual, this isn't the way they normally are. If that's the case, you can still call your pediatricians, but you could also bring them right to us. We have 24-hour-a-day pediatricians in the hospital here. Our emergency specialists are trained in pediatrics. We will see the child. If we have any concerns, we will bring our pediatrician down for the case, and we will put our heads together and we will fix whatever problem there is. So if you have any issues, if you're concerned, you bring your child into us and we will take care of them. If you're an adult and you have a fever, adults with fever are a different thing, right? Adults, whereas kids will often run a fever of 101, 102, sometimes even 103. Adults do not run fevers that often, right? So if you're a 40, 50, 60-year-old adult and you have a fever of 101 or 102, something significant is going on, right? Now, it could just be the flu. It could be COVID, right? But it could also be something else. So the way to generally distinguish the severity and how important it is to get care is based on what other symptoms you might have with it. If you're running a fever and you have aches and pains and your nose is running and you have a little cough, sure, that might be the flu. That's fine. It also might be mild COVID. That's fine. Pick up the phone, call your doctor, let your doctor evaluate you over the phone and decide if you need to come in. If instead you have a fever and you're having rigors, which means shaking chills that you can't get your body to stop moving, that's a sign that you could potentially have sepsis, meaning whatever infection you have could have spread to your bloodstream and could be causing those rigors. That is serious. That is time to take yourself into our emergency department. We have full sepsis protocols in our hospital, which as soon as we see somebody with potential sepsis, we initiate those protocols. We start broad spectrum antibiotics. We start other medications that we need. We draw labs that will tell us how severe the infection is, and we jump right on top of it, because it's been demonstrated that the most important thing in treating sepsis, treating a severe infection like that, is how quickly you get the antibiotics on board. And we are trained to do that in a very quick, expedited way. What do you do if you're having a breathing problem? Well, breathing problems are easy to decide whether you need to go to the emergency department. If you do not have a chronic respiratory illness, for example, asthma or COPD, and you are having problems breathing, that's a serious condition. That requires evaluation in the emergency department. You call 911, let them come and get you, and they'll take you to our emergency department. The importance of calling 911, by the way, is that, and I know a lot of people are reluctant at times to call 911. They're embarrassed because, well, what if they're not really seriously ill? What if they're, what if it turns out to be nothing? Do not think like that. That is a foolish way to think. Our first responders are, again, they're there to help you, and they are actually happy when they come out to somebody who's having serious symptoms and it can turn out that they aren't going to be seriously ill. That actually makes us happy. We're happy to help, and we're happy to see people get well. But if you're having shortness of breath, the EMS, the first responders coming on the scene, they have tools that can help you. They have medications that can improve your breathing. They have oxygen that can improve your breathing. they can stabilize you in the time it takes to get you back into the emergency department. So if you are short of breath, there are a number of serious diseases that can cause that. It could be caused by a cardiac disease. It could be caused by a pulmonary embolism. It could be caused by allergic reactions. Come to the emergency department. We will very quickly be able to determine what is the cause and very quickly be able to determine how to make you better and how to improve your symptoms. Abdominal pain. Abdominal pain, by the way, is the most common presentation to an emergency department. And everybody has had abdominal pain, right? So we all know what it's like to have a bellyache. The question is, when is a bellyache not just a bellyache? And that certainly is a tough question. So the things, and again, I'm talking about adults now. The thing that differentiates it is, number one, I have pain in my belly and I also have a fever, right? That is a bad sign for an adult because there are a number of serious diseases, appendicitis, diverticulitis, cholecystitis, infection of the gallbladder, that can cause abdominal pain with fever. So if you have those two things together, or serious urinary tract infections, pyelonephritis, again, fever and abdominal pain, you should be coming to the emergency department. We have our CAT scanning machines 24 hours a day. We get a CAT scan within usually half an hour to 45 minutes, and we'll have an answer and we'll figure it out. So yes, abdominal pain with fever, you should come to the emergency department. How about if you have abdominal pain, you don't have fever? What other associated symptoms do you have? Is the pain localized, right? And as opposed to sometimes when you get a normal bellyache, it's kind of all over your belly, right? You're cramping, it's colicky, it's all over your belly. That's usually a non-significant abdominal pain. If you have abdominal pain that's localized to one area, it's in my right lower quadrant, think appendicitis. It's in my right upper quadrant, think your gallbladder. It's in my left lower quadrant, think diverticulitis. So when it's localized to one specific area, it's a little more worrisome. It probably needs a more serious evaluation. Is it associated with nausea and vomiting, right? Am I vomiting seriously that I can't keep fluids or can't keep food down? That's a serious condition. People come to the emergency department all the time with severe vomiting, sometimes severe diarrhea associated, and they're so dehydrated that their blood pressures are low and they're feeling horrible. We can take that, we can hydrate those patients, we can ensure that whatever's going on in the belly is not serious. After a couple of hours of hydration and evaluation, maybe a CAT scan, we can say, you know what, it's just food poisoning, or it's a viral infection of your bowel. You're okay, go home, keep drinking fluids, come back if you need to, but you're gonna be okay. Follow up with your doctor. As far as injuries, injuries are generally pretty easy to determine if you need to be in the emergency department. If you break your arm, you're gonna know it. You break your arm, come to the emergency department, right? We have the capability of splinting it, fixing it, capability of calling in orthopedists, doing whatever we need to do to repair that injury. If you have a laceration, we repair dozens of lacerations a day. Let me see, dozens a day? Probably at least 2 dozen a day of lacerations. We're excellent at it. If you have a laceration, come into the emergency department. And sometimes it doesn't need to be sewn. It may not need to be sutured. Because we have glue, we have skin adhesives, and a lot of times we can just glue the laceration. But it doesn't matter. We're happy to do that. Come in, we'll evaluate it, we'll make a determination. If you hit your head, a little more serious, right? Because if you hit your head, whereas if you break your arm, it's an obvious injury. You can see the injury. You know that you've broken your arm. If you hit your head, you don't know if you have a serious injury inside your head. So when should you decide if you should come to the emergency department if you hit your head? Well, what's associated with it? Were you stunned by hitting your head? Meaning, when you hit your head, did you lose consciousness? Were you dazed? Did you not know where you were for a while? Well, an injury like that probably should be evaluated in the emergency department, and we can determine if you need further treatment. If you have other reasons why a head injury is serious, so for example, are you on blood thinners? Are you on Coumadin or Xarelto or Eliquis? All of those things put you at risk for bleeding if you should get a head injury. So if you do, you should come in and be evaluated. Are you elderly? Elderly folks can more seriously injure their heads if they have head trauma. Come in, let us evaluate you. Are you having any symptoms after the head trauma, like weakness or numbness in any extremity or any places? Your vision changed? Come in and see us. Have you lost consciousness? Come in and see us. We have concussion centers in the RWJBarnabas system. We will see you. We'll evaluate. If we think you have a concussion, we'll refer you into our concussion centers. We do that a lot with young athletes, high school students, to make sure that they're safe to be able to go back to sports and to be able to go back to school and such. Strokes. How do you determine the significance of neurologic symptoms? Any significant neurologic symptom, anything that's new and different, should be evaluated in the emergency department. Any weakness or numbness, any part of your body not working, any change in your vision, you should come to the emergency department as rapidly and quickly as you can, because we have medications now. We have tools that can abort strokes, medications that can remove clots or dissolve clots that are ongoing strokes. And if we do it soon enough, we can actually reverse entirely the symptoms of the stroke and cause no residual. And we do that all the time. We have neurologists available 24 hours a day. We will identify the stroke. We will give the medications as necessary. And we have wonderful services. If you do need, if the stroke does cause any significant disability, we have the ability to do rehab. We can do all of those things. So I think that's covered most of it. If anybody has any other area that I haven't covered, just let me know.
Thank you, Dr. Fontanetta. So I would like to have Donna DeVita, who's our director for the emergency department, talk about her team, our team, and their commitment and what you should expect from them when they greet you and you come in through the emergency department. Donna?
Thank you, Terry. So yes, I'd love to talk about our team, but first I would just like to thank our community for all the support that you have given us during the time that we had in the pandemic that we did go through. Your support and donations to us was wonderful, and it really gave us the strength to go on. So thank you. But moving forward, our team has really done a great job in protecting themselves and protecting you as well. We know how important it is for you and your healing process to have the support and guidance during your time in the emergency department, which we work hard at providing that for you. One of the things that's really important to us is that you're able to have your family at the bedside, as that is important to Clara and RWJ in general. So we do allow a family member at the bedside with you in the emergency department at all times, so that we can they can be part of your plan of care. So our staff will round with our leadership team and ensure that you're being informed and that you are moving along in your emergency process. So I'd love to introduce Bianca, the Assistant Director for the daytime, and she'll tell you a little bit about what we do to ensure that you are safe while you're in the department. Bianca?
Thank you, Donna. Good evening, everyone, and thank you for taking the time out to participate in this call. Our goal and primary focus at Clara Maass is to first serve you and our community and to provide you with efficient quality care. And a part of serving you and providing you with that quality care is to ensure that our department is clean and safe for you and your family. A part of those initiatives that we have taken thus far is to first identify which patients are either respiratory or febrile or have any symptoms of COVID, as Dr. Fontenetta had stated, and safely transporting them to the appropriate room where they will still receive the exact same care, whether they came in with COVID symptoms or not. Next, we have a very wonderful environmental services team that does a very job and is very diligent in ensuring that our rooms are clean by using some of the best products and cleaning those rooms with our new UV machine, along with other machines that help to sanitize the rooms before and after a patient comes in. Our team is very knowledgeable on the proper techniques as far as donning and doffing, which is putting on PPE and taking off the PPE when they exit your room. So you can be sure that once they enter your room, they wash their hands, as Terry stated, they remove PPE, put on new PPE. Our team has been blessed enough, along with your donations and what our hospital has provided us with, by having enough PPE to ensure that we are maintaining proper infection control protocol. Lastly, as Donna had stated, we do leadership rounds in our department to ensure that everything is up to par and meets our expectations so that we can provide our community with the care that they deserve. We appreciate you all very much.
They
And
tried to get me for Saturday, but I got out of it.
aside from everything else that I have
Well, we
mentioned,
don't have as many people anymore. Like people went some.
aside from everything else that I have mentioned, you can be sure that each person that comes into your room, from our greeters in the waiting room that check your temperature to the physician down to the nurse,
But it's just, she stopped
you can
talking
be
when I
sure that
first
they are caring for you with the most care.
people left. You know,
So
kids
again,
went back, kids that were
you
school kids.
for taking this time
Congregate
out, and should
went
you
back
or
to
your
school.
loved one be sick, we
You know,
pray that you
things
choose
that
Clara
we
to
don't have
serve
it.
you and your loved one. Thank you.
I hit some of the Zoom classes, advertising that
Wow.
in the middle of the Zoom video.
I know. Well, we need people to get some EMT.
Donna, would you like to Eduardo?
Hello, everyone. Hi. I think some of you know me. Well, first and foremost, I would like to thank everyone for joining us in this event. This is very exciting. This is like kind of new to everybody, and yet we're excited. So everything that Dr. Fontanetta said, Donna DeVita, and Bianca said, that everything, the quality of care, when to come to the emergency room, I would like to emphasize that it goes on 24/7. Even if you come middle of the night, 10 p.m., 1 a.m., 3 a.m., 4 a.m., it's the same quality of care. It's the same process when you first come in. We screen you for COVID. When you get to triage or you go directly to your room, it's the same process for cleaning. It's the same process, the same doctors, certified doctors that will see you. It doesn't matter whether it's 7 p.m., 7 a.m., 1 a.m., or even 4 a.m., 5 a.m., 6 a.m. The quality of care continues 24/7 in Clara Maass. In fact, the whole hospital continues, and we don't stop. We don't stop for anything. So you can rest assured that you will be taken care of anytime you come into the emergency room. So thank you.
Thank you, Eduardo, so much for that. I would like to ask Dr. Mazzarella, who is our Chief Effectiveness Officer, to say a few words. Dr. Maz? Dr. Mazzarella?
Sorry, I had myself on mute.
That's okay.
I'm
Please.
sorry. Good evening, everybody. Thank you so much for everyone who's participating tonight. This has been very, very helpful. It's wonderful to have our emergency department reintroduce themselves into our community and just share with them what we are doing to ensure their safety. Patient safety is our paramount mission. And when you're in the hospital, we are trying to make sure that your course in the hospital will be as efficient as possible to move you on to the next phase. When you're ready to leave, whether you're going to go home, whether you're going to a subacute, whether you're going with home care, we will try everything that we can to make sure that this does happen. First and foremost is patient safety. We will never discharge a patient if we think it's an unsafe discharge, and we will do everything we can to ensure that you will be safe. Our case management and social services department is available for anything that you need. We work very closely with the Department of Nursing. We work closely with the medical staff, and it's all for the patients, and it's all for the community that we serve. And I've been part of the Clara Maass family one way or another since I don't even want to tell you how long it's been. And I am deeply rooted to this place. So thank you. Thank you so much for asking me to speak.
And Terry, one thing I want to add in, go along what the other folks have said. During the COVID pandemic crisis, the community was so helpful and so giving to our hospital providers. It was a very difficult time for us. It was mostly, having to wear all that equipment, having to deal with, with so many people who couldn't have visitors, and it was very sad. But the community stepped forward and donated just so much stuff to us in the way of food and in the way of things to cheer people up and such. It was really such a demonstration of the support the community has for us. And it made us really feel very special and very nice.
There was a lot of gratitude from the community, from the families, from the politicians in the area. Really, we were. I agree with you, John. We were very, very blessed during that time.
You're right, Dr. Maass. One of the real special things that we have at Clara Maass is really the way that everyone works together as a team. It's a true family environment, and then we bring that out to the rest of the community, because at the end of the day, that's who we're here for you, families, and we're here for each other. And we want to share with you that what our words are saying translate right into the care that we provide to your family when we're caring for them, and whether it's taking their temperature or giving them instruction or just holding your hand in one of the most difficult times, because an emergency can happen 24/7 any day of the year. But we want you to trust us that we're here for you during that entire time. So Stacy, I just want to know, do we have any questions from the community or from any of our friends?
I don't see any questions in the chat, but if there's anybody
that's on the forum that
would like to unmute themselves to ask a question, please feel free. We'll have a few minutes left for questions. Any questions? I see user number 5. Any questions from the attendees? Just feel free to unmute yourself and ask a question. Okay, Terry, I don't believe we have any questions from the community.
Thank you, Stacy. One of the things that makes Clara Maass special is when you have true leadership vision that helps everyone understand what we're for. And so we want to thank our CEO and President Dr. Mary Ellen Klein for continuously living the commitment to serve our community in the best way that we possibly can. And so continue to become better at what we do by practicing everything that we've shared with you today, time and time again, because that's the only way that we can become better for the patients, for your families, for your loved one. So we thank you for choosing us. Mary Ellen, do you have any closing words for us?
I just want to thank everybody on the panel tonight, and Dr. Mazzarella as well. Dr. Mazzarella has been a internal medicine physician in the Nutley area for many, many years. He's one of the physicians to, I think, all of us, and really makes an impact in the lives of others. But we so appreciate all that you do and everything that we can do for you. We're here for you. I'm not sure, we may have a question.
Yes, I have a, thanks. I have a question For people who are not in the medical community, how do we differentiate from COVID and the regular flu symptoms? Because, for instance, in my case, I am in the school system, I'm very concerned. And even during the flu seasons, we're extremely concerned. We're sending students back home, and now as districts are preparing to welcome students back, so there's a huge confusion. We do not know what would be COVID and what would be a regular flu season.
Well, I can answer that. That's actually very easy. You can't.
Yeah.
The symptoms, unfortunately, the symptoms for COVID can be very varied. And the classic symptoms for flu is fever, body aches, cough, sore throat, and runny nose, right? That's the classic symptoms for flu. But COVID could have all of those same symptoms, right? The things that would make me a little more concerned for COVID would be shortness of breath, right? Flu patients rarely have shortness of breath. They'll have cough, they'll have fever, but they usually won't say I'm short of breath. COVID patients commonly say, with severe COVID, commonly say I'm short of breath. So that's one symptom that would certainly lead me more towards COVID. COVID patients are less likely to have the runny nose and such, but that can vary either way. One thing is loss of taste and loss of smell. That has been a very interesting, almost pathognomonic symptom for COVID infections. So if somebody says they can't smell and they can't taste, that would make me very, very suspicious for a possible COVID infection.
And you want to stay safe at school. We understand that could be a concern. Similarly, we would encourage you to keep hand sanitizer with you in your pocket, at your desk if you're teaching or working with the students. Be able to wash your hands frequently, keep your hands away from your face if at all possible. Continue to wear your face mask. If the students appear to be sick, depending on how you all negotiate that with the student to get to the nurse's office and out of the class, we're fortunate we take everybody's temperature and we make sure nobody has a fever. I don't know, and I can't speak to what they may be doing in the schools, but even with the other teachers, they should be aware, and the other staff, it's not just teachers, but the other staff at the schools. Have they gone to any of the places where there's quarantines? Have they been around people who may have been infected with the virus or who are sick themselves? And do your own social distancing, even if it's in the lounge where the non-students and the staff eat. Separate yourselves. If there's a pizza pie, I would encourage you not to dive in. If it's split up separately, you've got people's hands, God forbid they sneeze. You may not have a mask on while people are eating. Keep your distance from one another in your own way. And just some of those safety tips. And Dr. Fontenetta or the ED team, any other tips that you may have? Because we understand trepidation that must be going through your mind every day.
Yes.
To the school.
Yes. Well, one thing, by the way, to let you know, if somebody comes in, for example, to us and has symptoms of a viral syndrome, we actually we have a viral panel that we run. It has about 14 different viruses that are tested for that include flu A, flu B, COVID, RSV virus, parapneumovirus, and about 6 others. So we can't always tell for sure. So we run the panel and we see what virus the person has. I think the most important thing is wear a mask. I really think masks have made the most important impact on this virus. And by the way, everybody's worried about the flu season. I personally think we're going to have a relatively mild flu season. And the reason I think that is because all the things we're doing to protect ourselves from COVID is also going to protect ourselves from flu. If everybody's wearing a mask, we're going to see a lot less flu. If everybody's hand sanitizing, we're going to see a lot less flu. So I think that anybody with a fever needs to be evaluated. There's no way to tell otherwise than that. They should be isolated until they're evaluated and such. And that's the only way we're going to be able to keep people safe.
One more question before you go, because this is very significant. And again, I commend you for this beautiful community event. Surprisingly, based on my interaction with parents, they fear to take their kids to the doctors because they think that by taking them to the doctors, they may be coerced in taking the vaccine. So there is an there's a vaccine phobia within the parents community, and we try to encourage them. But I'm glad that the CEO, Dr. Elaine Klein, I'm glad that she at the beginning she
Just
did
Mary
encourage.
Ellen, that's it.
Yes, I'm glad that at the beginning that she did encourage her. So what? We are not medical professionals, but we just want to take your words. And what other thing that we should say, because parents are very fearful, and as the vaccines are being prepared, what should we say to encourage parents to welcome this?
Well, first off, nobody should be afraid to go to the doctor. Doctors, a patient always has a right, whether they want a vaccine or not. Right now, certainly we are big proponents of vaccination. We think that vaccination is helpful and important. But if a patient comes and says they don't want the vaccine, they don't get the vaccine. I mean, patients have the right to choose. So you should not be afraid. And parents should have a relationship with their pediatrician so that the pediatrician understands their views on vaccines. They should be open-minded, listen to the pediatrician, but the pediatrician also has to obviously respect what the patient and the family wants. So I think that they should not be afraid to go to the doctor, and they should not be afraid if they didn't get the vaccine to go get help if they do get sick, because we don't not treat people because they didn't get the vaccine. Of course not. If somebody comes to us, we're more than happy to take care of them, whether they were vaccinated or not vaccinated. So I think it's important for people to seek medical help. It's important for them to understand that they have the right to guide their own health care and to not be afraid to go to the doctor and say, look, I don't want this vaccine. Again, let me be clear. I'm a big proponent of vaccinations. I think the flu vaccine is important and helpful for many, many different reasons. But if a patient doesn't want the vaccine, they have the right to refuse the vaccine.
Thank you.
And if we can be of any help to you, we do have community
health
staff, yes, that if you want us to come out, or Dr. Fontenetta, I know I'm putting him on the spot, or the ED team, the leadership team here tonight, and you'd like us to come and address something or do a virtual for the school, we're more than happy to accommodate you.
Absolutely.
We're all in this together. Our goal is to keep you happy. We know that part of our business is taking care of sick people, but we prefer you be well and you don't have to come to us. But we're more than happy if that's something that you'd like to do. You can reach out to any of us and we'd be more than happy to coordinate it and try to allay some fears. Maybe it's even the Clorox wipes at the desks with the kids. Maybe you want the kids to wipe down their desk before they start, before they leave. The teacher's desk, you may want some gloves when you're touching the knobs, or kids go down the stairwell. I try not to touch the stairwells when I'm out and about in the community because I don't want to touch them. Different little things that you may be important or relevant for the school and the lounge, the bathrooms, things of that nature. Just please let us know and we're happy to help.
And we've gone out, by the way, our team has gone out to dozens of schools. We've lectured on very many topics. We can lecture on vaccines, the safety and efficacy of vaccines. And we've consulted for townships, our townships on safety for COVID, for example. What is the best way to protect their staff and such? So we're available to do all of those things.
Thank you.
Yes.
Thank you very much. Stacy? Where are we in our program, Stacy?
Did you call me, Terry?
Are we reaching the end of Casey?
Yes, we're at the end of the program. We did post our community health number, the number to our community health department in the chat, as well as a link to our website. Feel free to reach out to us, as Dr. Klein suggested. Thank you.
Thanks.
Thank you. Well,
Thank you.
thank you everyone for joining us tonight. Wish you only health today, tomorrow, and all days.
Yes.
But if you were to
Yes.
please know that we're here for you. Thank you for choosing us. We thank you for trusting us. Most of all, remember, consider it a privilege to serve you and to care for you in your time of need. And if there's anything that we can do, just let us know. We wish you the best of night.
Thank you.
Thank you.
Bye-bye.
Good night.
Thank you. Good night.
Good night.
Bye-bye.